You've waited weeks, maybe even months for this appointment. You have a list of things you want to talk about, a dozen symptoms you want to describe. You sit in the waiting room rehearsing it in your head, but then you get into the room and it all happens so fast. The doctor's rushed, you feel flustered, and you walk out realizing you didn't get a fraction of the things out that you wanted to talk about today. And then sometimes you leave feeling unseen, unheard, and frustrated. So if that sounds familiar, I want you to know that you're not alone. The healthcare system is designed for efficiency. It's optimized for physicians and healthcare providers to be able to treat patients quickly and move on to the next. And unfortunately, for a lot of people watching this video, this means you've had to deal with feeling overwhelmed or ignored, talking to healthcare providers, appointments that felt like a waste of time, and even really lacking the answers or direction you need to get better. My name is Dr. Lisa Jasper, and I have a PhD in Rehabilitation Sciences. For decades, I've been researching these topics and working with people with chronic pain, but I've also been on the other side of that conversation. I've been the clinician in the busy clinic with back-to-back appointments. I felt the pressure to keep pushing through on a busy day and prioritize efficiency. So in this video, I'm going to share strategies that can help you effectively communicate with healthcare providers. So as I previously mentioned, the system isn't set up for long, thoughtful conversations. And unfortunately, for patients, that can often mean feeling like you're not being heard. While I can't change the way the medical system is set up or guarantee every experience will be positive, I can help you speak the language of healthcare that will help transform your appointments from a source of frustration into a productive partnership. So today we're going to talk about an insider's perspective, and I'm going to teach you the framework I teach my patients and the same framework that I wish every patient knew when they walked into the clinic. It's a simple 3-step strategy that can be one of the most important tools to help you manage your chronic pain and improve the outcomes of your appointments. So the framework is called the 3P framework: prepare, present, and partner. It's designed to give you the tools to make you an effective advocate for your own health. It's not about being aggressive or confrontational or pushy. It's about being clear, confident, and collaborative. So the first step is defining your number one goal. A short appointment can often only realistically accomplish one major thing. So you need to figure out what that is. Do you need a referral, a medication adjustment, or discuss a new symptom? You really need to think about what your single most important outcome is for this appointment. And then secondly, you want to gather your data. Doctors and other healthcare professionals are trained to identify and respond to patterns and facts, and unfortunately not always feelings. So this is where your tools can come in. I always recommend coming to your appointment prepared with tools or data that can help you describe your symptoms and your experience. A simple pain diary for 1 week, noting how your pain changes with certain activities or through rest or activity. A clear typed medication list or a flare-up plan that shows you what you're already doing to manage your symptoms. This can help show that you're an active participant in your health, and it gives you concise information to pull from if you're feeling overwhelmed. And finally, you want to prepare talking points for the main topic that you'd like to discuss. And we're going to talk about using a tool called SBAR here, which is a tool that healthcare professionals are taught to use to communicate with each other. So it stands for situation, background, assessment, and recommendation. And you can prepare 1 or 2 sentences just for each of these points. So step 2 now is present. So this is how you deliver your message. So now you're in the room. This is where your preparation pays off, and it will allow you to take initiative. So you want to start with your goal. The moment the doctor or the healthcare professional asks, "So what can I help you with today?" You can say, "My main goal for today is to discuss a new plan for my morning stiffness," for example. So this gives the appointment a clear focus. Then you can deliver your SBAR statements. For example, let's say you're someone who's been suffering from persistent morning stiffness. So you start with S for situation. So you can say, "For the last month, I've been having severe morning stiffness that lasts for 2 hours. Then you can move into B or background. "As you know, I have a 5-year history of chronic low back pain, but this level of stiffness is new for me. A, now assessment. "I believe this is significantly impacting my ability both to get to work on time and to do my job once I get there. It's gone from a 4 out of 10 to an 8 out of 10 consistently." Then R, recommendation. "I'd like to discuss if there's any medication adjustments or referrals we could explore to address this issue." So, do you see the difference? You just presented a clear, data-driven case in under 60 seconds. You've done the work for them and made it easy for them to decide on the next steps. So this brings us to step 3, or partner. So once you've presented your case or your information, the dynamic can shift. You are no longer a passive patient. You are a partner in the problem-solving process. And this is where you can also use collaborative language. Instead of saying, "What are you going to do for me?" ask, "What are our next steps?" If you disagree with a suggestion, and that's certainly valid, you can do your best to not just say no or give up, but rather you can ask clarifying questions, and you can use I statements. For example, "I understand you're suggesting whatever new medication. I do have some concerns about potential side effects I've read about. Can you help me understand why this might be a good choice for me right now?" So this isn't about challenging their authority or being argumentative. It's about inviting them into a collaborative dialogue. So you're creating a team dynamic, and it's important to, as much as possible, welcome that back and forth discussion while getting your needs addressed. As a clinician, I can tell you that having a patient who comes in prepared with a clear goal and ready to work as a partnership makes it so much easier for us to give them the help they need and allows us to do our best work. People are never taught how to effectively communicate with their healthcare providers, and as a result, it can often result in miscommunication and patients not getting the help they deserve. However, the good news is you do have more power than you think. I can't make any guarantees because every experience will be different. But by implementing these strategies, it can greatly improve the likelihood your healthcare provider hears you and is able to meet your needs. So mastering this skill is one of the most important steps you can take to improve your experience with healthcare providers. If you found this guide helpful, please subscribe, because in our upcoming videos, we'll be diving deeper into specific tools you can use to prepare for these conversations. Thank you for watching.